What great talks this morning. Thank you to Jenny Joseph and David Williams for really presenting great insight to all of us in the state of Delaware, and greatly appreciated. It's now my great pleasure to introduce Representative Melissa Minor Brown. I mentioned this morning that we're going to hear from the voices of the Delaware Healthy Mother Infant Consortium. Representative Minor Brown has been a strong advocate for all of us, and is going to tell us all about a resolution in the state of Delaware. Turn it over to you, Melissa.
Thank you so much, Dr. Paul. So on April 12th, Senator Pinckney and I introduced a resolution recognizing April 11th through the 17th, 2022 as Black Maternal Health Awareness Week. And I'll just go through some of the things that we've already talked about today, which is that data shows that the U.S. is one of only 13 countries in the world in which pregnancy-related deaths are on the rise. Excuse me. Black women in the U.S. suffer from life-threatening pregnancy complications twice as often as white women, and they die from pregnancy-related complications 4 times as often as white women. And racial disparities in pregnancy-related deaths across all income and education levels show that Black women in the U.S. are at a higher risk of poor outcomes than white women. And multiple factors contribute to these disparities, such as variation in quality healthcare, underlying chronic conditions, structural racism, and implicit bias. Social determinants of health prevent many people from racial and ethnic minority groups from having fair opportunities for economic, physical, and emotional health. Also, the state of Delaware ranks 28th in the nation for highest prevalence of infant mortality at 12.5 infant deaths per 1,000 live births. The Delaware Black infant mortality rate is 3 times higher than the white infant mortality rate of 4.2 infant deaths per 1,000 live births. And this is prior to the first year of life. I do want to recognize the efforts of the DHMIC and the Delaware Perinatal Quality Collaborative and many other stakeholders who are working to promote various promising efforts such as the OB Hemorrhage Initiative to reduce maternal and infant mortality, morbidity and disparities, and improve public and professional awareness of the issues related to improving maternal health outcomes, related to women's experiences at childbirth, and also critical postpartum care, especially for women of color. And then the various grassroots organizations that are boots on the ground working in the community, such as Black Mothers in Power. Every woman deserves quality, affordable, culturally respectful maternal health care. And we in Delaware, we have the ability to create that and to do it in an intentional manner to ensure that we recognize our biases that exist and address them by improving care delivery and developing a multifaceted approach to addressing persistent and dire health disparities, and the social determinants of health, which are the conditions that individuals live, work, and play. So I just want to mention this is not just April 11th through the 17th. It's not just a week to recognize, but a time for all of us to adjust our mindsets and begin to take meaningful action in addressing these disparities. So thank you for allowing me to just go through the resolution that recognizes April 11th through the 17th as Black Maternal Health Awareness Week in Delaware.